everybody. I thought I would do a short video and answer some of the questions that people have about coaching and about the CCI Certified Coaching Program, and give a little update on what's going on with the coaches right now. And for that, it's mid-September 2020, and we have about 57 coaches in 8 countries. And that's exciting. They're doing really interesting work, filling in the gap between what happens when treatment professionals are coming up with good goals and things for clients to work on, and then the client just can't seem to go through with those at home, in the trenches, in their house, in the restaurant, in the grocery store. And so that's what coaches are doing. They're an adjunct to the dietitian, to the therapist, helping the team help the client succeed in accomplishing those behavioral goals that are absolutely necessary for people to become fully recovered. And a lot of questions people have about the course, for example, how long does the course take? And that really depends on the person who takes it, if they have a full-time job, how quickly they go through material. There's material and videos. There's about 12 modules, and we originally set it up for a person to go through a module a month. We have since expanded that and let people have about a year and a half as opposed to a year to take the course. And then people can opt in for another 6 months if they really need to, for a small additional fee. But most people are finishing the course on time. We've had people finish the course in 5 months, 6 months, so that just depends. And it's a very rigorous course. I mean, if I was going to put my name on it, I wanted to make sure that people are trained, and they're trained in a way not to encroach into the therapy role or the dietitian's role. And that means there's this line sort of drawn in the sand that coaches work on how to help the person get better and deal with specific behavioral goals in the day-to-day life, as opposed to why did the eating disorder happen, or dealing with comorbidity issues, underlying issues. The coaches really come up with specific goals. They either get them from the treatment team, or they can help create them themselves with the client and the team together. And then they help the client work through those goals, like trying new foods, eating scary foods without purging, interrupting a binge cycle. So coaches might be called in the middle of the night. They might be getting several texts in a week, email exchanges. It's a different kind of relationship than the relationship with a therapist or a dietitian that those treatment providers don't have time to do or ethically can't do. For example, we have some coaches doing live-ins and some coaches who go home and stay at people's houses during transitions, for maybe from residential treatment, for example. Sometimes coaches do that to help someone hopefully avoid needing a higher level of care. People ask a lot about the business aspect, and so once you're a certified coach, you're on your own. So you can either start your own private practice as a coach, or some people have been hired by other people who have coaching businesses. A couple of CCI certified coaches have gone on to open their own coaching business, and they hire coaches. But you have to look at the laws in your different states for what legal requirements there are. Coaching is new, so there's not a lot of legal requirements, but there might be in terms of having a business license, and we do help people with things like that towards the end of the course. There is a supervision piece in the course, which is really important. I currently supervise all the students in the course, which means that during the internship, after you pass all the quizzes and the exam and all that and go through the 12 modules with the reading and the videos, you do an internship where you have to see clients and tape sessions on a secure platform and send them to me, and then I listen to them and provide feedback and get involved if I need to. And once you pass the internship, then you become certified. That may take a bit of time. It depends on where you're getting your clients and We try to help people find clients and do placements if we can. So far, nobody's ever not become certified because of that. Let's see, what are other questions, frequently asked questions? There's a part in they ask about, people sometimes want to know about the exams or the quiz material, and it starts off each module with the quiz being true and false or multiple choice type thing, and then it goes into open-ended questions. So I can really see the grasp of how the coach uses the material and can relay the material to a client. So I'm super excited about what's happening with coaches. On the website, you can see there are videos of both clients and therapists and dietitian, I think, talking about their use of coaches and how coaching has benefited, either whether it's the client talking or whether it's a treatment team member talking. So obviously, if you look at this and you look at the material on the website and you have further questions, you can always send me an email. But I hope this has helped answer a few of those questions, and I hope it's shown my excitement for what I feel like is a game changer in the eating disorder field.